Good morning and welcome to Chapter 13. We're going to do a little mini lesson, a mini lecture on Chapter 13. Let me share my screen with you. Okay, Chapter 13 is Surgery Guidelines in General Surgery. Not the most exciting chapter, but let's just talk about the highlights of our chapter. So we're going to talk about some details about the surgery section. It's the largest CPT section. The section format starts at 10004 and it goes through 69990. It's divided by subspecialty. For example, the integumentary system, the cardiovascular system. Guidelines are provided at the start of each section of the CPT. The information they contain allows the coder to approximately interpret and report on procedures and services included in that section. Okay, all of that saying is the beginning of every section. You're going to have some guidelines that will help you code accurately. So let's talk about some of the symbols. So you see the little triangles facing each other. That indicates text changes from the previous edition. So as you can see here, the arrow starts here, the triangle, and then there's another one at the end, and this indicates new or revised. Okay, subsection notes. So for example, if you look at the musculoskeletal system, you see that this is your subsection. Subsection notes apply to the entire section. Oh, and one of the things I want to point out is it has some notes, and these are going to be some definitions of importance in that section. For example, the term closed treatment, open treatment, percutaneous skeletal fixation. You're going to be able to find lots of important definitions here. All right. We just went over notes, but we're going to talk about it again. Notes may be placed at the start of a category of procedures or services, in which case they apply to all procedures and services within the category. Let's look at our example here. This is figure 13.4. You see the category is grafts or implants, and your notes follow. Note restricts use of certain codes to situations in which the graft has not already been used as part of the procedure. That just gives us a little bit of information on our notes here. Category and notes apply to the entire category. Subcategory notes. Subcategory notes apply to the entire subcategory. So let's see. This is your subheading. This is your category. This is your subcategory. And at the bottom is notes. I know this seems a little redundant because obviously if you're looking your CPT codes up and you're seeing the notes, you should automatically read them. But I just want you to understand how important these notes are. So next we're going to talk about parenthetical notes. They provide additional information that will aid the coder making correct coding decisions. So parenthetical notes are in parentheses. So you can see here this helpful information is part of parenthetical notes. So next we're going to talk about unlisted procedures. Unlisted procedures are used only when a more specific Category 1 or Category 3 code is not found. A written report will accompany the submission. Each unlisted code service paid by case basis. So let's have a question. What documentation is required for an unlisted procedure? Guys have learned about special reports. If you use an unlisted code, you must attach a special report. I lost my train of thought. A special report. So now let's talk about separate procedures. Now, again, I want you guys to understand that I am reading information and the information seems complicated. So we're going to read the information and then we'll talk about it for just a minute. So CPT codes designated as separate procedures are considered to be incidental and bundled with any related comprehensive major procedure when performed during the same section, through the same incision and are at the same anatomic site. A separate procedure may be reported if it is the only procedure performed, or it is unrelated to or distinct from the procedure performed during the same operative session. Okay, so I'm going to give you an example. During a partial hip replacement, the surgeon also performs a hip flexor tenotomy. In this case, 27005 is a separate procedure, but is it truly separate from 27125? It is not, because remember, if you're going in at the same incision, it is not going to be a separate procedure. It will be bundled together. So separate procedures means that you're going in through a different incision site and you're going into a different surgery that really has nothing to do with the other surgery. Let's think. Okay, so say that she's going to have a partial hip replacement, but then she's also having a knee replacement. It's going to require two separate incisions, so it's going to be two separate procedures, which means you would amend a modifier to let the insurance company know, hey, wait a minute, these are not going to be bundled together. These PT codes cannot be bundled together and paid as one because they're separate. So what's going to happen is the third-party payer is going to pay for the hip replacement, and they're going to pay a separate fee schedule for the knee replacement. They're two separate procedures because there's two separate incision sites. I hope that makes sense. Remember, separate procedure doesn't mean that it was the only one performed. It only indicates how the code can be used. Let's talk about minor procedures. Are often provided on a service-by-service basis because they lack significant elements of preoperative and postoperative follow-up and tend to be straightforward and limited in scope. Major surgical procedures, on the other hand, are often coded as a bundle of services that reflects the standard of care the surgical patient can be expected to receive in connection with the procedure. So when you're thinking of minor versus major, this would make sense to you. Minor is not concerning, major is concerning. So the next thing we're going to talk about is what is included in a surgical package. The global surgical package concept includes the preoperative, intraoperative, and postoperative services and are considered included in the specific CPT code. The preoperative stages include local infiltration, metacarpal, metatarsal, digital block, topical anesthesia, subsequent to the decision for surgery, one related E&M counter on the date immediately prior or on the date of the procedure, history and physical, intraoperative service. Okay, let's back up just a little bit. Have you ever had to have clearance for surgery? That's what they're talking about with the E&M code. You have to have clearance for specific surgeries. So you're allowed that, and it's included in your surgical package. So let's talk about intraoperative services. They're actually performed in the surgical procedure. Postoperative services is immediate postoperative care, including dictation, postoperative notes, talking with the family and other physicians. So when you're in the room recuperating right after surgery, that's included in your surgical package. You're not going to be charged separately for that. This is also going to be included into your surgical package, is writing orders, evaluating the patient, in the post-anesthesia recovery area, typically uncomplicated postoperative care. Now, again, like I said, lots of words, but let's stop and think. Have you ever had surgery? Okay, so what do? Get cleared for surgery. You go, you check in, go to the we call it the surgical center here, the surgical center. The anesthesiologist comes in, you're provided care by nurses. You go to surgery, the surgeon does his procedure, then you go to the recovery area where you're checked on for that surgery, and you're either admitted or you're discharged. So that's all one surgical package. You're not charged for each individual step. So let's talk about our surgical tray. So what is actually on a surgical tray? Needles, suture, materials, wipes, drugs. You're going to report the surgical tray with the 99070. It's in the medicine section, and it's bundled into the actual procedure. It is charged within your surgical package. What set of codes is used for inpatient services and procedures? And what set of codes is used for outpatient services and procedures? Outpatient coders address physician payments with the use of CPT codes. Inpatient coders address the hospital or facility payments with the use of ICD-10 codes. Okay, now I asked that question. Let's talk about it. When you're admitted to the hospital, say after a procedure, usually the most that you're going to get from a physician is they're going to come in and they're going to check on you, your subsequent hospital care. They're going to come in for 10, 15 minutes, see how you're doing, blah, 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 blah. But where the hospital makes their money is how sick you are, which is going to be your diagnoses. Now, outpatient setting, what happens is you go in, you have your procedure, and you're discharged. You're using your CPT code to get paid the most money. I hope that makes sense. It's going to make sense when you get on the job to how that works, because you'll be dealing with claims every day, and you're going to understand the difference in the pay scales. I wanted to just add a surgical tray, just one of many, because surgical trays, there's tons of different ones. This actually happens to be, I believe, a dental surgical tray. See the little mirror. Well, that's chapter 13 in a nutshell. Like I said, lots of information, not exactly the most exciting chapter we've done, but please be patient. The excitement is coming. We're going to start coding really, really soon. And we're going to be taking the CPT section by section. You know, we came out of anesthesia. The next is the integumentary system, and that can be all the gross, oozy things. You know, look forward to the fun. I hope you guys learned something. Have a great day. Bye-bye.